Hi, it's Paul Feuerstein here, technology editor of Dentistry Today, and what a pleasure to be here with Joe Masad. Joe, what a pleasure to talk to you. Joe's been my go-to person for anything removable, anything with pink acrylic, anything with acrylic teeth, porcelain teeth, you name it. If it comes in and out of the mouth, you go to Joe and say, it's going to stay in the mouth when I do it. Joe's, you're out of Tulsa, Oklahoma.
Tulsa, Oklahoma. Yeah, I've been there in practice for 42 years.
42 years.
Yeah.
And if you haven't seen Joe in lectures and his team, whether it's hands-on or just a straight lecture from the podium, there's so much to learn from you, Joe. I'm really thrilled to be here with you.
Thank you.
So we're here talking about the Zest Corporation. The Zest Corporation has been around quite a while, and they've done something called removable fixed teeth, dentures, things like that, overdentures. And we used to take teeth, we'd chop them off at the gum line and do root canals and put little attachments, Zest attachments, and there'd be snaps in the teeth. And now in a new world, why would we do that when we can get a much better situation with a much more predictable implant situation? So you go around and you see ads, even as dentists we see ads, and we have people saying, what's an all-on for? They hear these words and things like that. So the Zest company actually has a very nice solution for all these things. They've had a locator that they've used for years. It's called they call, I guess, the legacy locator, but now there's a new locator called the RTX.
Yes.
So in either case, what's the whole process involved? What do you have to do to make these things actually work?
And on patients who we're not going to do fixed, okay, we don't have enough area to put in implants, maybe 2-4 implants is maybe the max, then the option would be probably an overdenture. So implant retained. So we use stud attachments. So the locator we had used for many, many years, and then the RTX came out, and the material was actually superior than the other. It actually was aesthetically even looked really good. But one thing that it did, it would handle the angle. So initially in the legacy, they would take the little nub out of one of the ones that was off.
So it would rotate like this.
So it would rotate. Well, with the RTX, there are no little nubs in there, and they will actually be able to correct up to 30 degrees. And then 30 degrees, you've got 2, you've got 4. It will actually correct that. And that is really nice. Also, the strength, and I test these, and I ask patients questions all the time. How does it feel? How's it feel when you come out? Actually seems more retentive. And
well, isn't the design of the little male a little different too? I think it has an extra little ring around it or something.
That's right. That little extra ring on there, bump or whatever you want to call it, actually gives it additional retention, and that's really nice for our patients. Now, you could use the old, which is fine, the legacy, but when you're going to start a new case, if you just use the RTX, then you have you have less inventory. It's easier for the patient. The nylons don't have any nubs on them now.
Right, they're all about the same. They're just different colors mean different strengths and different.
That's right, and when they package it, they give you everything.
It's a little kit like
that.
A
little kit has everything in it, so you don't have to order a bunch of different parts. So it actually simplifies a lot of things. And takes care of the angle without having to do angle abutments.
And one of the nice things they changed, finally, was you don't need a fancy screwdriver, you can use a standard hex.
That's right. I tell you, I've got so many drivers, I don't know what to do. I think I get the wrong driver, and then you get frustrated. Everyone.
We all do the same thing. We have a patient coming in, you pull out 15 little screwdrivers, and you're sitting scratching your head. I'll try this one next. It's kind of something.
I mean,
so can you if you had severely angled implants, this would be a solution then?
Yeah, absolutely.
What if you had multiple implants? If you had, say, on a lower case 4 implants, is there any issue if they were all in different angles?
Well, you can actually correct those in 30 degrees. So you've got 30 here, you can actually, it'd be 60 when you kind of add all of those together. But basically, the angle, that's quite a bit tipped.
Yeah.
And it's very easy to pick up. So it's not difficult. They have instrumentation where you can actually drill an exact orifice very, very nicely. So they have improved the armamentarium to make it much easier.
Well, they also have that self-cure. There's a dual-cure material called chairside that's very, very helpful. I started to use that myself. That's very, very nice to use, too.
That's right. You don't have to bonded at all. It sticks really well, so just use as much as you need, no more.
And one of the other things I did note was that the housing itself is, I think it's sort of opaque, a little more white, so it doesn't show through as a black, as a dark thing in the middle of the denture.
Yeah, that's the aesthetic thing I was saying, because
Yeah.
a lot of times I would have to actually,
You have
a
to
lot of
mask
times
it
I have to
sometimes.
mask it, yeah, with a little bit of peak underneath. So it's a
So it's a good
very
step
good
forward.
option. Yeah.
It's a good step forward.
Yeah, good stuff.
So Zest is out there. They're still doing pretty much what they've done before. They've just brought it up a notch. The RTX locator. Information, I suppose, is on the website. And Joe, always a pleasure. What a great seeing you.
Yeah, thank you.